Hi, I'm Dr. Choi. Heard you're having some belly pain.
Yeah, it's not a big deal.
He fell down the stairs.
Really? How'd that happen?
It was nothing.
He was carrying a pretty heavy box of books. We're packing up to move next week.
And everyone thinks reading's good for you. Might have a broken rib. I'd like to get some scans and make sure there's nothing else going on, but it doesn't look too serious. I'll be back to check on you in a little bit. Is there anything else?
No, it's just he's been a little clumsy lately.
But that's normal, right? Tripping over his feet, he's just growing into his body?
It's probably nothing, but since we got some time, I'll run some blood to rule out any infections or toxicities, just to be sure.
Thank you.
All right. All Kevin's scans show are a broken rib and a pretty good bruise on his kidney. So I agree with Dr. Choi. There's no neurologic reason he fell. He simply slipped.
I'd like nephrology to get a look just to be safe, but then he should be okay to leave.
So he'll be all right to drive across country next week?
Mom.
Shh.
Let the doctor talk.
It might be a little uncomfortable, but he'll be fine.
Thank you for all your help.
You got it.
My advice, bring some pillows.
Can somebody help me?
What happened?
I don't know. He can't move.
Kevin, squeeze my fingers.
Just wait.
Can you feel my hand?
Ray, let's get him to CT now.
What? What's happened?
I think your son's having a stroke.
Oh my God, Kevin. No.
Still no improvement.
He's always been so healthy. What could cause a stroke in a 15-year-old?
Not much. And he's negative for the usual suspects. So if his MRI is positive, we'll have to start looking for less common causes.
I'm not gonna have to stay overnight, am I?
Kevin, not now.
Dr. Halstead, Dr. Choi.
Excuse us. MRI?
Yeah.
Still no evidence of a stroke. This can't be right.
Well, it may not be. It says it's a poor study due to patient movement.
So it's inconclusive.
Tell MRI we're sending him back out for a repeat scan.
Are you kidding? If this is a stroke, we're running out of time.
Doesn't his affect strike you as weird? So little concern?
He's a confused teenager who's probably also in shock.
Well, I don't like it. It doesn't add up.
And we should figure it out after we treat what may soon become permanent paralysis.
I'm not going to risk a massive hemorrhage and a transfusion for no reason. He's going back to MRI.
Too many people losing focus today. It's dangerous.
Is that right?
That patient in there, Kevin, 15-year-old with hemiparesis, but his attending is fixated on his mood rather than his symptoms.
What do you mean?
He seems a little detached, but he's just a kid, trying to play it cool. So now we're wasting valuable time ordering scan after scan when we should be treating him.
Kevin, how are you? I'm Dr. Charles.
Hey.
I understand you're having a little trouble with your left side.
Oh, yeah.
Yeah. How you doing with that? I know it can be a little scary.
It's not that big a deal.
Excuse me, Dr. Charles. This patient's scheduled for an MRI.
Yes. Okay. Well, nice to meet you.
Yeah.
Excuse me, I'm looking for my friend. Is this the visitor's entrance?
For the ED, yeah. Well, has he been admitted yet?
I don't know. He said he can't move his arm or leg. It sounds really bad.
His name wouldn't be Kevin by any chance, would it?
Yeah, it is.
Huh. Tell me, is your buddy like a real cool customer? You know, like a James Dean type?
Who's James Dean?
What I mean is he the kind of guy that doesn't really get too worked up about stuff?
Kevin, you're kidding. They're making a move to California. Of course he's worked up.
You gotta move?
Yeah, they're just dragging him away.
Huh. You're gonna miss him, huh?
Yeah.
Sorry, tell me your name. I'm Dr. Charles.
Emmett.
Emmett, nice to meet you. I think that there might be a chance that we could help your friend. Could we go see him together?
Yeah. Oh, okay.
Do not administer that TPA. Dr. Choi, no. The hell are you doing?
His window's nearly closed. I had no choice.
No, you don't have a choice. I'm your attendant.
And you're not willing to do what the patient needs.
So you're 100% sure of the correct clinical course, because to me, this is not a clear-cut case.
Doesn't mean we can avoid making the hard decisions.
Even if those decisions might kill him.
Gentlemen, if we could take a beat, this young man might help us shed some light on the situation.
Hey, man. Emmett, what are you doing here?
I was worried.
You were worried about me?
Yeah, man, your text said you couldn't move. I didn't know if you were dying or paralyzed. I just came as fast as I could. It's all good, Kat. It's all good.
We had no idea.
It seems like he's been harboring thoughts and feelings that he wasn't comfortable expressing, and his body found a way to express them for him.
So he wasn't actually paralyzed?
No, but he was experiencing real symptoms. It's why we call it a conversion disorder. It's the physical manifestation of a psychological desire.
Desire. Sounds like you're saying he wanted to be paralyzed.
I'm saying he didn't want to move, and his subconscious decided that having a serious medical condition might be a good way to accomplish that.
That sounds crazy.
Crazy? No. Complicated? Sure. But if you think about it as a whole, an understandable response to what must have seemed like an impossible situation. You know, having to leave somebody that he couldn't tell you about, somebody for whom he had very strong feelings.
But if he was so upset, why didn't he seem to care about being paralyzed?
Compartmentalization is just part of the condition. But trust me, your son cares. I mean, he cares a great deal.
Just to be safe, we'd like to observe him in the hospital overnight.
Then probably a good idea for the three of you sit down and have a talk.
They're getting a room for him upstairs. I'll let you know when it's ready.
Thank you.